You can touch it if you want to. Lean up on it. They're comfortable. What that does is that as you lay on that thing, what happens is over time, air is leaking out of it all the time. It's actually designed. If I were to take that mattress and submerge it into a swimming pool, what you would see is all these tiny little bubbles. And what happens is air is constantly leaking out of it, and what that does is it's basically kind of like moving the patient and really promotes healing of those ulcers. So if you were to ever have a patient on a stage 3 or a stage 4 ulcer, you would not want them on a standard mattress. You wouldn't even want them on one of those mattresses. You'd want them on one of these mattresses because it's going to help heal that patient. Okay, let's talk about what qualifies a patient. This is important because you guys are on the front line, and this is where you'll see, you know, Mrs. Smith, I think might have a stage 1, and she's sitting on that hard hospital bed mattress. We might want to get her on one of these. So, for example, any of your patients, if they qualify for a hospital bed and have any one of these conditions, incontinence, impaired nutrition, compromised circulatory status, or altered sensory perception, they qualify for one of those mattresses. So let's just quickly break it down. So what this means, if one of your patients is wearing diapers because they obviously can't fill their bladder, they qualify for one of those mattresses. Because if you want, one of those things, I have a couple daughters, and when my daughter was, young, and if I didn't change her diaper, what would happen? Spout it up. What would happen if you don't change your baby's diaper? Rash. You get diaper rash. Kind of like, it's kind of nasty, but what happens if you get that rash? It gets red. So you take that in a patient. Adults, as you know, can get diaper rash as well too. That can very quickly turn into an ulcer. So a lot of times it might just be that. So that's one of the main reasons. If you have a patient that's incontinent, your stroke patients, definitely your dementia, and Alzheimer's patients, they're going to qualify for your Group 1 support services. So if they're not currently in one, you probably need to say, hey, why don't we have them in one of those? Because it's one of those things, if we get them on that, then hopefully we don't have to get them in the more expensive mattress. Medicare would like that too. Medicare is all for saving money, as you've heard of all the cutbacks that are going on. So it's one of those things. If we can keep saving Medicare money, that would be a good thing. I already talked about the alternating pressure pump and pad. That's what we call them APPs. That's why that's kind of hard to say. So if you say APP, we'll know exactly what you mean. On ours, you can at least, they have a little dial knob. I call them kind of their sleep number. You can make them really hard. You can make them really soft. There's gel overlays. Occasionally we use these. We don't use them a whole lot. If you ever do have a patient with gel, one thing you have to do with gel is it will cool. Is at least once a week that caregiver needs to knead that gel back to the middle. So if you have a patient on gel and you're like, that doesn't look quite right, it will literally bottom out. You need to knead that gel back.
How long does it take for the gel to return to the bottom out?
It will return once you knead it back.
I mean, no, from its good condition back to bottoming
It
out.
depends on how heavy that patient is. On average, 1 to 4 weeks. But if you get a patient that's like 300 pounds, you're going to have to do it every 3 to 4 days. If you get little Miss Lightweight, who's all of 80 pounds soaking wet, maybe once every few months. So it's really, how heavy is your patient?
Thanks, so.
Now let's talk about low air loss mattresses. It's kind of funny. Guys set this mattress up over here. One of the most common questions I get on late at night is someone, usually from a facility, will call me at like 2 o'clock at night, 2 o'clock in the morning. Mrs. Smith's bed has gone flat, and I'm like, oh. And it was kind of funny because guys set this up. And he's like, man, this bed is not inflating very fast. On the side of all those mattresses, and what I'll show you, there is a CPR. There's a CPR tag over here. So what happens is, if you ever have to use CPR on a patient, you can't use CPR on this mattress because it's very, what you do is you actually will pull this out and it will deflate the mattress. Usually what happens sometimes in the middle of the night, you guys are doing a patient transfer, someone will accidentally pull that out, letting Mrs. Smith sink down to the ground, and then you call me up, your bed's not working. So if you ever do come across a mattress and it's gone flat, check the CPR tags first to make sure that Mrs. Smith hasn't accidentally pulled it out or You know, some kid who was in the room said, hey, I wonder what happens if I pull this red tag. It will actually cause them to sink. And that's almost always the problem with that. So this is how an alternating pressure mattress works, which is this guy over there. What happens is it alternately inflates and deflates air chambers inside that mattress. So you'd actually see them going up and down, up and down, up and down. Then there's another one called the low air loss mattress. This basically works. This is kind of what I was telling you about. There's tiny laser drilled holes that continually blow air upwards towards the patient. This cool, dry air helps to wick away the warm, moist air caused by patient fevers, sweating, incontinence, thereby managing heat and humidity issues to prevent maceration. So this would be like on a hot day, what do? You put a fan in front of you, it cools you down. So same thing with the patient. They can't move around a whole lot. Those tiny bubbles are always going through the patient and will help with their ulcers. Another thing, this is not on part of the presentation, just to let you know, if you have a patient with ulcers, one of the worst things you can do is just layer them up with incontinence. I've seen patients with like an ulcer and we'll put a really expensive mattress on them, and then what certain caregivers will do, they'll put a diaper on them, they'll put an insert, they'll put a disposable chucks pad, they'll put a reusable chucks pad underneath the patient. So what we've done is we have this really expensive mattress, but we've negated it because we put all this clothing underneath it, so it's not allowing the moisture and wicking to take place. So it's one of those, you need to always understand what you've put underneath the patient versus what you've actually put on them. So, and so basically the whole purpose, we want to get that patient down and sinking into that mattress. So if you were to sit on a memory foam mattress, it feels good because there's more surface area. It's like if one of the women here, you're wearing high heels, and all of a sudden you step on some guy's foot because he's made you mad. If you step on his foot with that high heel, it's really going to hurt because all that pressure is going on that tiny little end of your heel. Same thing with a patient laying on a mattress. You got that tailbone or that pressure point. If all the weight goes onto that, it's really going to cause skin breakdown. It can hurt the patient. There's other Group 2 options out there. We have lower systems. We actually have a really expensive mattress. It's about $12,000 that will actually turn the patient throughout the night every 10 to 15 minutes. That would be one of those where you call me up on the phone and say, Eric, we have a Group 4. You know that nasty picture you showed me up on the screen? We have one of those, and we're having a hard time healing it. Then you'd want to get one of those. I actually have a really expensive mattress that will shift the patient back and forth so we can get them healed. In the old days, they would have one of you guys stand by the bed and have you move them every 10 to 15 minutes. So it's good for your boss and also the patient that you guys don't have to sit there and do that. Now we have a machine that will do that. So anyway, that's pretty much it with in regards to therapeutic support services. I'm going to jump on to the next part of the presentation. But if you have any questions, definitely ask. Yeah?
Do you have much problem with all this causing them not to sleep? I mean, on the one hand, you have a sore that's causing them not to sleep.
Correct.
On the other hand, you have a change in their traditional way of sleeping, causing them not to sleep.
So does this cause them not to sleep? I would say on certain products and certain patients, yes. What I've noticed, sometimes those plastic APPs will bother the patient. It feels different. And because of that, that's actually why we have 3 different products. We have the APP, which is a plastic that actually I think works the best. But we also have the straight foam mattress. So for the patient where the APP doesn't work, then I would say, okay, let us bring out the foam mattress. And I had no one ever complain about the foam mattress. And then if both those still don't work, then we can try the gel. And usually the gel works unless the patient's really, really heavy. And they always like that to get go, but then it's usually a week, a month later down the road, it's not very comfortable anymore.